Very good evening, my beloved colleagues. Welcome to the DOAMS activity. And myself, Dr. Osman Gani here. Can anyone help me, please? Can you hear my voice well and can see the screen well? Anyone, please?
Yes, doctor. Yes,
Oh,
doctor.
thank you very much. Thank you very much. So, Doctor, we decided to talk about on contraception choice today, and this is our pleasure to share as before. And I feel always glad when our colleague requested us to do some activities will be beneficial for you and others as well. And I can remember in the last classes, some of you also requested to do some other activities. So in this time, we decided to go on today on our topics today. Before going that, I like to introduce some important tactics of class today. It is not just that I will be talking and will be listening. It will be an interactive class today. As much as possible, you can share your opinion. But definitely, some of candidates face some hurdles of different scenarios of contraception choice. It is not only for the exam. Usually, we like to decide some common topic of common interest. In general, not for the general physician, whatever, even some specialists also, those who are working in the reproductive health science or reproductive health, rather to say, these are important for them as well. So we will try our best to make you understand everything, and we will also a little bit speedy as well. So even then, what we will do, we will give you one scenario. You will read it as quickly as possible. Followed by, actually, we will give some highlights of the scenario, that is of the question. Then we will discuss answer related. So with these few words, Dr. All of you, we'd like to introduce our institute as before. And just we're entering now to our topic. Before going to the problem-based learning, just showing a slide of the characteristics of ideal contraception. So you have to see that this, if we say which one will be the best ideal choice of the contraception. So we need to fulfill all the criteria. And it is very fact that possibly we will not get a single contraception method will fulfill all the criteria 100%. It is very fact. But when we search an ideal contraception choice for any specific patient, we have to consider these all of the things. Anyway, so we are proceeding now. Please be with us, and I like to show that these are the available contraception methods in the world now. Possibly you might not have seen many things here. Those who are not working in this field, especially for the gender issue, the South Asian peoples usually oriented to go to the female doctor for any problem. The female patient going to the female doctor. So those who are a male doctor, you might not have seen some of the devices. So just have an idea, there are male contraception devices or medications as well as the female. Okay. And before going to choose, there are some common contraceptive devices or the methods. The sterilization is the permanent one, no doubt. So this is the most effective one, no doubt, but there are some pros and cons, and this is a permanent. No reversibility is very unlikely. If you go down barrier method, very least effective contraception methods, but almost no side effect, almost no health hazard. Okay, and the reversibility is 100%. So everywhere there is a pros and cons, and in our day-to-day life we have to consider it. These are very commonly advised contraception methods. And in the exam also, you will have to see many questions roaring around these things with these methods: tablets, devices, injection, and permanent one. We will discuss today also not only the choice, whether some missed pill issue also important, and with some side effects very later. So now I'm going to that. Don't worry if you cannot see the detail, we will provide you the PDF also later with some important issue. Now come to a case, how we will run today's class. And if you see one patient is here, a 21-year-old nurse comes to the clinic requesting contraception. She works shifts, including nights, and so often wakes up at odd times of the day. It's very, very right part and parcel of our day-to-day life for the doctor and nurses as well. She has recently married, and may want to start a family during the next 2 years. Her mother suffered a DVT 3 years ago. On further questioning, she has some problems with the libido and has heard that progesterone only based preparation may impact on this. Just may I have some support from all of you? Anyone, please? May I request anyone that can you identify any keywords here? Any decision-making factor? Please, who can say? Spontaneously, please. Anyone? Decide.
Progesterone only based preparations.
I am not asking the answer of you, doctor. You just, please, doctor, be connected for a while. Don't be disconnected again. Nice, doctor. Thank you. You just tell me what are the factors that I think she's a nurse. One thing here, like that, and the work shifts, how it is, can she maintain the contraception device if we offer? Will there be any contraindication? Any other personal issue? Suppose the libidinal issue is there. Similarly, yes. Doctor, I asked you, can you summarize again, doctor, what factor you are in your mind? I will show you even then. No worry, you just tell me something. What you are considering the factors which will guide us to select a good contraception method for such person.
She wants to start the family in 2 years.
Yes.
And her shifts and plus yes. DVT from like family history of DVT.
Yes, very right, very right. So DVT may be a contraindication for those. Yes. So better proceed now. Now going to the keywords, and many keywords may be in your mind. If you think more keywords, you can discover many keywords. These are our attention to guide you further, that when we get the history and we examine the patient, actually our plan is to make a good management plan. So you see that the work shift is important here. The recently married, I mean that the libido will be a great factor here, and young, they are not elderly, so no baby right now. And again, doctor said that nicely, next 2 years, after 2 years, they want to have a baby. So they should need a reversible one. Definitely, you will not choose a sterilization method. Everybody will agree. So these are the factors considering, and including the DVT also, though I didn't mark, and I can mark now also for you here, as you say, the family history, if you consider it a family history, good. So I'm going back again, the projection could be. So all of you have the freedom to consider this thing. It is not that what we are marking, this is the only thing. You have every freedom. So from there, considering all the thing, including the, what I say, we just give me some chance to correct it. The DVT 3 years ago, mother actually, the family history in the mother. So considering this thing, your decision how we will make. Before that, we need to consider, confirm that she is pregnant or not somehow. Irrespective of the culture, society, whatever the religion, whatever we say, before the marriage also, a lady become pregnant. It is not impossible. So considering this, when she actually had the menstrual period before, and there are some clues, that means that in the practical situation, we have to consider that she is pregnant or not, then we will advise. Finally, the whole description is given here. I don't like to read the detail. Again, we tried our best to highlight with the different colors. So considering the libido, newly married, and even from the progesterone pill as well as the double hormone pill, combined contraceptive pill, there is a window period also that is the missed pills when patient can get after the missing time as early as possible without any risk within how many hours. It is called the window period. So combined pill have a better window period than the progesterone only pill. So I think all of you will agree the answer will be the combined contraceptive pill. Someone uttered maybe progesterone, but actually here the combined pill will be the best choice. Combined contraceptive pill will be the best choice. So this is the technique, doctor. I tried to show you how to proceed with the next patient related. Why we have chosen this thing of our study? My beloved colleagues, be attentive to me that if you go through many books, you may have very, very good books of textbook. You are reading in a manner that a headline of contraception methods, description, other things. But if you don't feed your knowledge with your patient, you cannot do your good practice. So the concept of learning is problem-based learning. So problem-based learning means a clinical patient-based learning. So if you go through all of our academic materials in the YouTube, you will find in any of the master class like that, you will find this where we are discussing the things by keeping a patient in front of us. So they are one of the patient, but you can silently read it, doctor, and identify some keywords. And I will show you in the following slide with the keywords. So I will not utter, it will take more time also. From this scenario, if you have the habit of rapid reading, it is good. So you see that the 45-year-old diabetic, this is the one important, another one, the smoker, hypertension. She does not suffer with migraine, and there is no personal family history of the breast cancer or venous thromboembolism. Many things are there. So we just highlighted few things here. And following the recent lipid check, she has an appointment with another colleague to discuss her dyslipidemia. So considering all of the things, what will be the safest contraceptive method for her? Please, anyone can tell me now what you are thinking? Did you think that copper coil before? Anyone? I don't know. Whatever you are thinking, the copper coil will be the best choice for such patient by having in the mind. Dr. Sarah, possibly any query? Dr. Sarah?
Yeah, because it is category 3 according to the UK.
Yeah, if you go to the guideline, you know, but I don't like to utter this word very loudly because most of us possibly we are dealing with South Asian culture anyway. It is better that as South Asian having no definite like these clean cut the guideline or protocol, whatever we say. But whatever the protocol, whatever the guideline, these are scientifically based. So we can follow this, right, doctor? Thank you very much. So the copper coil will be a good choice because there are some comorbidities, some comorbidities. Okay. Yes. So oral contraceptive pill is linked with cardiovascular and cerebrovascular disease. So with the cardiovascular and cerebrovascular background, better to avoid the combined contraceptive pill. And this lady actually a little advanced aged also. So copper coil over there. So now come to the second, doctor. Please have a look and try to give your answer spontaneously as early as possible. Anyone? Then I will go to the keywords as well as the decision, doctor, so that we can finish many cases today. As we tried our best to collect almost all the types of scenario regarding the contraception choice. Please, doctor, anyone give your answer. Don't worry that you may be right or wrong. So we are here, all are learning. So if you give the wrong answer, no problem. No problem. Please, anyone. So 20 years old female, I'm just skipping my words, like a tab in the computer. Requesting the contraception. She's in a cheated relationship, but no desire to start family, no respect for venous thrombosis in her family history, and drinks approximately 12 units alcohol. Yeah, doctor, someone.
Progesterone.
Which one, Dr. ABC? You can mention also. Depo-progesterone. Yeah, depo-progesterone.
Yes.
Yeah, doctor, be connected just for a while so that we can interact smoothly. Who has given the answer? Better be connected, doctor. You are the most benefited one. So unfortunately, your answer is not there. There is a Dianeti. Dianeti. Why Dianeti? Patient having, apart from the acne, That means patient having the acne, otherwise well. So Dianetics and the combined pill, doctor, Dianetic. So this is the answer. The Dianetic is the most logical choice in anti-androgen because the patient having the acne also, right? Dianetic can help in acne resolution as well. Okay, so this is the answer. Don't worry, doctor. Don't feel that why my answer is wrong. We are all learning here. Okay. Then come here, doctor. Please go through and give your answer quickly. A little longer options are there. 21-year-old single mother just registered. Your practice means in your chamber, you like to continue progesterone for contraception. She cannot remember when she last had the injection. Okay. So she has no symptom or sign of the pregnancy and last sexual intercourse 14 days ago using a condom and a normal period 6 days ago normal period. Now, what advice you will give to her? So she's on the injectable contraception.
D.
Yeah. D. Repeat the injection with no restrictions on intercourse. Okay. If anybody have difference of opinion, doctor, you can share quickly. Quickly. So I'm showing the keywords now. Answer is C. Answer is C, that repeat the injection and advise avoidance or barrier method for 7 days after the injection. So this type of decision making, this type of question sometimes warrants more attention beside, because many informations are there in the A, B, C, D, E step, doctor. Doctor, why didn't you select the C? Can you give some idea, doctor? Sorry, doctor, you are not connected who has given the answer. We are very grateful to you that you have shared your opinion. So, doctor, anyway. So description is there. I hope you can get a snapshot, doctor, from this screen so that you can get the correct answer of this. And I hope and I assure you that we will make our class, doctor, be accessible to all of you. Don't worry if you miss anything. Don't worry. Okay, now come to the patient number 4, fourth patient, doctor. Quickly, doctor, go through and give your opinion. 25-year-old female presents with heavy regular menstrual loss. So there is a hemorrhage is there. She has never been pregnant and planning to start trying a family after her wedding in 15 months' time, and currently using condom for contraception. She tried combined contraceptive pill in the past, but forgot to take it at times and thought it made her gain weight, so discontinued it. So weight gain, one of the side effects of hormonal pill contraceptive. She has no known drug allergy, BMI 35. She is bulky, body weight is more. So what will be the best choice here? Can anyone please?
C, weight loss advice.
D.
Appropriate management. D, another colleague saying that
B.
Intrauterine system.
B.
Marina.
Mirena. Another one is the Mirena, medicated device, right? Mirena is the medicated intrauterine system. So it's nice that you're opining differently so that now you can understand. So fantastic, the advice. Doctor, who has chosen this E? Can you explain that? Why didn't you choose other? Doctor, please can you share your opinion?
Heavy menstrual.
Heavy menstrual, yes, very right. Yes, immediately it will give contraception as well as stoppage of the bleeding. From this choice, so we have to consider this issue also, right? So I hope that you will get benefit, doctor. Even there is a body weight also there. You see, BMI is 35. So, and she's worried also about the weight gain. So the hormonal pill may not be a best choice here, right? Thank you, doctor. Thank you. So IUS is treatment for dysfunctional uterine bleeding as well as the contraception as well. And I can remember in our OSCE courses also, we discussed one case like that. Those who attend, I think possibly you know, are the colleagues, those who passed AKT. Anyway, now come to the case number 5. So as much as possible, I am reading for you, doctor, very rapidly. 16-year-old presents requesting contraception and keen to consider the injection. Keen to consider the injection. That means she wants injection. Which one of these statements true regarding the use of injectable progesterone? That is the Depo-Provera. So it's a small question. Try to choose the STEM doctor from the 5-1. Please, Dr. quickly read it very sincerely with concentration. Give your opinion regarding the injectable one. Yeah, Dr.
E.
Iman.
E.
The fertility can take 2 years to return after stopping the use. Okay, let's see. Let's see.
D. D.
B. Oh, another one saying the B. Any different opinion?
D.
B. It's normally given every 2 months. Okay, okay, let us see. Eh,
D. D. Not
D.
replying.
Oh, D. Okay, okay, D. Yes, yes. D is the answer. It should not be considered fast in the adolescence. So why others are not correct? Please, doctor, request you as short as that time. You can make a snapshot, doctor, for all of you. There will be some noise, sorry. So you can be unmuted by yourself again. About the noise, I just muted. So you can make a snapshot, doctor, from here. From here, if you want, you can go through this. Now come to the another case, a little longer, doctor. You have to face on behalf of all of you, I am reading. So you are saying 32-year-old female, 22 days postpartum. So you're dealing a patient postpartum, and she was advised by the health visitor to come to see you to discuss starting contraception. So we are dealing now a postpartum contraception. She had normal uncomplicated vaginal delivery 24 days ago after a routine antenatal period. She is fit, well, no significant medical history, non-smoker, no family history of importance, no regular or over-the-counter medication, blood pressure 112/68, BMI 24. She is feeding her baby by the bottle and has not been sexually active since giving birth. So it means that she is not pregnant again. Apparently, she is keen to start using a contraception from today. What will be the best one?
Combined hormone contraceptive.
So in the postpartum contraception, you are meaning combined one. Okay, any difference of opinion? Any different? Any different? Dr. Sahida.
B. IUC.
IUC, intrauterine contraceptive. Okay. Welcoming other opinion, different opinion. Better not to repeat the same.
Progesterone only pill.
Progesterone only pill. So we are happy that you are thinking by yourself in
E.
favor. E, progesterone only pill. Okay. Okay, doctor. Okay, okay. Intrauterine contraceptive, doctor.
Doctor, combined oral contraceptive مش contraindication 6 week post delivery.
Usually we can choose the progesterone. You are right.
Contraindicated, yes, yes. Yes.
Sorry. Actually, we started a little differently, right? I'm sorry. The question was contraindicated, not the choice. Sorry, doctor. It was
Contraindicated, yes. Yes.
Yeah, doctor. Thank you, doctor. Thank you. This is an reflex developed to say this. Yeah, so we need to attend the wording, right? Contraindicated. So it's a mechanical device, maybe hazardous for the unprepared uterus, right? Usually progesterone will be the good choice. Progesterone will be the good choice. Thanking you, doctor. Thanking you. So please make a snapshot quickly if you want from here. So better not to read everything. Fine. So doctor, now your patient, seventh patient, doctor. So I'm reading now very quickly. 38-year-old with 2 children comes to the CEO requesting contraception. You can reasonably sure that you have excluded pregnancy and risk of pregnancy. I told you before giving the contraception, we have to exclude pregnancy. She is in a relationship going away on holiday tomorrow with her partner, and neither individual is keen on using condoms. It is very, very practical, right? Whilst on the holiday, abstinence from the sex is going to be difficult, you know. And her last period was 10 days ago, and she has not had intercourse since that time. from last 10 days, no intercourse, assuming there is no contraindications and that the method is acceptable to her, which one will be the most suitable? I think you are ready now to give the answer. Can anyone try?
Progesterone only pill.
Progesterone only pill. For the short time, you are getting E. Short time. Any different option, please? Anyone? Any different? You take your time, doctor. 2 seconds. No problem. We need to learn. Hurriness doesn't mean that we will skip our knowledge. Try your best.
Combined or
Combined pill. Combined pill. No problem. No problem. We need to give the answer, doctor, to our patient, right? Not to pass the exam only. So these are very practical situations. The holiday, they will enjoy the holiday. So copper bearing intrauterine device suitable for her. So not the pill, devices. Why devices? I think you will argue against now. Can anybody argue against? Copper. Can you see the white copper? Is it the issue that the 10 days or something like that there? I like to read it, doctor. The copper.
It works immediately. It works immediately.
It works immediately. Yes, it works immediately. That is the clue. That is the clue. And no one is contraindicated. So you can choose from. I'm going back. You can choose anyone without any contraindication, which will be the best for them. So answer that immediately. Immediately.
patient using condom, doctor.
I'm sorry.
Patient using condom.
So they will not. Already you have seen that, doctor. They don't like condom in the holiday. You see what is that? It's written somewhere. They don't like to use condom, doctor. Okay. Neither individual is keen on using condom. I think you did not address this. Neither individual, partner or this patient you are dealing, they don't like the condom. For that, it is not the answer. I think you got the clue. So I hope that I believe, doctor, we are going one by one cases. So we have a few cases more. After going through, you can have an idea how to choose. But we will be getting 2-3 cases of this choice. But I like to say in the middle that we need to know all the situations almost. So now the patient number 8. Please, doctor, have a look. And I am reading on behalf of you now. The 26-year-old lady ring by the telephone. So ring by the telephone. Patient is not in front of you. So she's 25 days postpartum and had unprotected sexual intercourse 72 hours ago. That means after 25 years postpartum. Sorry, 25 days postpartum. No significant medical history and no regular medication. Oral feeding, doctor, not the breastfeeding. She is unsure if there is a risk of pregnancy and whether emergency contraception is needed. Actually, they want baby now. Which one following most appropriate advice to give in these circumstances? Please, doctor, please, anyone.
A.
Emergency contraception is advised in oral levonorgestrel 1.5 milligram, early pistol 30 milligram are both safe. Both,
It
okay.
can be C or E.
Doctor say only one by only one. You not two. Let
Maybe.
other. Which one? C.
I think E.
E means emergency contraception is not required. Oh, very intelligent answer.
E. أيوة.
You are also in the E. It
No,
means
need A.
emergency needed, emergency contraception needed. So you can give emergency contraception. So emergency contraception is another topic, doctor. I will give you the page number and some information also for emergency contraception. In which situation, which emergency will be better. And this is again, doctor, the explanation. And you are free, doctor, to take, there is no restriction of taking the snapshot or other. As much as needed, doctor. You have every right and privilege to take the snapshot so that we can manage our time and not be busy with only one patient. So now come to patient number 9, 29-year-old female, advice wants to have the contraception. She last had depot medroxyprogesterone injection 18 weeks ago. 18 weeks means 4 months, 4.5 months, and would like to continue with this method of contraception. So it's already 4 months over. She was a menoric on depot and has remained a menoric since. She last had sexual intercourse a month ago. She has no contraindication any forms, but her preference is to continue depot injection if
No,
possible.
دقيقة ما تظني.
What would you advise, doctor? What would you advise? So go through the detail of a STEM, doctor.
C.
You are thinking C. Perform a pregnancy test. That means you need to exclude right now pregnancy test. Administer progesterone only injection if negative, with barrier contraception for 7 days. Okay, if negative means if the pregnancy test is negative, right? And in the meantime, barrier contraception for the 7 days in addition. Okay, any other option? Any other option? Any other opinion? No one? Maybe you are busy with surrounding also, eh? Don't have enough time to read. Anyway, very, very right, doctor. Congratulations to you. Nice answer. Nice answer. So this thing, when emergency contraception needed, we need to know. We need to know. Patient is on a regular contraception, but somehow missed, or the missed pill, or some contraception failure somehow. Immediately, we need to know what will be added. So you see the unprotected sexual intercourse. UPSI means unprotected sexual intercourse has occurred more than 3 weeks ago. So do not offer emergency contraception. What is that actually the mean? Doctor, can you explain what you have answered this thing? Who answered it? Has been more than 14 weeks in class. So if he has more than 14 weeks since last injection, so it was 18 weeks there. 14 weeks means not 3 months, 3.5 months, around 3 months, a little more than 3 months. Okay. Or 10 weeks for non-ethisterone. Non-ethisterone, you know, working around 2 months, and the medroxyprogesterone working around maybe more than that, yes. And the unprotected sexual activities occurs more than 3 weeks ago, do not offer. But situation is not fitting this condition. For that, you need to give the extra protection. That is the thing. Okay, okay, understand now. So the 10th case, 40-year-old woman presents requesting contraception. So it's an information type question, information type. And which one of these statement is true now? Please choose. If you have gone through the question before, doctor, you take time and give some chance to other colleagues so that they can understand. A single elevated FSH is highly suggestive of ovarian failure. Okay, any other option, doctor? Anyone? Dr. Hind, possibly. So far, I can read the Arabic. Sorry, doctor, I can't read detail, but I can read a little, doctor. B, Mirena coil. Sorry, doctor, maybe having the noise, you can control the noise by yourself, doctor, if you have. Mirena coil inserted 45 years of age or older may remain until contraception is no longer required. Okay. And any other option? Maybe no. Let us see. The answer B is correct. I think the answer single 4 messages here.
Oh, single elevation FSH? No, single.
Better
LS
double, right? Doubling is
Okay.
important. Doubling is important. Yes, doubling is important. And better not to choose any HRT. HRT is not contraception. HRT only just hormone replacement. Hormone replacement, right? Thank you. And 11, question number 11, please. Which one of the following situation can an intrauterine contraceptive device be used? In which situation? Very simple, but very interesting question. Please choose one. Dr. Hind is here. Yeah, quickly, Dr. Hain.
B.
B, a patient who is significantly immunosuppressed. Okay, any other option? I think all of you in the same opinion. Let us see.
E. E.
B.
E.
Patient with a history of ectopic pregnancy.
Yes.
Okay, history of ectopic pregnancy. What is that? Contraceptive be used in the ectopic pregnancy. Contraceptive be used, but in another situation, not good. Any criticism from here? Who can criticize? Any criticism? Let us see. These are absolute contraindication of IUCD. Above the 4, these are absolute contraindication, right? Wilson's, a
Wilson
proper
disease.
metabolic problem, right?
Yes.
Immunosuppressed, so IUCD have a common complication of the infection.
Contraindication.
Malignancy. These are the contraindications. So
Yes.
patient with the history of ectopic pregnancy. That is the history of ectopic pregnancy. Okay, history of ectopic pregnancy. Now patient doesn't want to have a baby. Patient doesn't want to have a baby right now. So history of ectopic pregnancy will not contraindicate to use IUCD now.
Yes, yes.
A
Not
little
contraindicated.
technical, yeah, it's a technical message given, no? Technical message
Safe.
given. Okay, thank you. Now patient number 12. 34-year-old lady comes to see you for advising a static contraception. Doctor, as I'm reading, be technical, though who didn't attend before, you know the nature, and I'm reading in a manner what you have to do in the exam, because you know 200 questions you have to finish in 3 hours 30 minutes. So for 1 minute, you need to complete your reading and everything in the decision. So I'm reading, not reading each and every word. I am trying to read the key words from here. So try to make a habit like this. So 34, if you want to read also, I will not mind, you can read on behalf of everyone, as you are sometimes silent and busy with some otherwise, so I'm reading. 34-year-old lady and for contraception, right? She recently started a relationship and wants to cover herself against pregnancy. And completely healthy herself, doesn't suffer migraine, non-smoker. Mother, breast cancer 10 years ago. Treated and now she has been given all clear. All clear means mother actually and no problem right now. And the patient has the patient have a gene mutation. You know, the gene is responsible for the malignancy. And her BMI 23 and the blood pressure given 124/82. Would you safely advise based on information you know about her? Which one can be given safely?
B.
Trying
means
copper coil.
intrauterine copper coil, not the medication, right?
Yeah.
Not the
Okay, safe.
medication, as he has the gene. I think very easy decision making here. Eh? It's a known gene mutation. So mother is clear, mother cured. It will not give us the satisfaction that we can give. So we have to avoid it. We have to avoid. So comorbidity always guiding us to choose contraception, especially whatever. I'm not telling about medicine. Even you know, you have seen that in the previous IUCD also comorbidity may be immunosuppression, local infection. These are the contraindication. These are. So please, doctor. Okay. So make a snapshot and come to the patient number 13. 29-year-old lady asking emergency contraception. So now ask some questions to her. That emergency, why, how many hours or days before she had unprotected sex. So unprotected sex 2 days ago and does not want to become pregnant, not taking any current contraception. Is not taking now. But she's depressed and takes over-the-counter St. John's wort. So the matter of drug interaction here, I don't know it is in your brief or not. St. John's wort, one of the antidepressant drug, and sold over the counter. She has fibroid 2 years ago, has not required any treatment for the fibroid, and not causing any problem at the moment now. So which will be the better one as an emergency contraception? Please choose one.
The Provera injection. A.
Depo-provera, medroxyprogesterone, right? Depo-provera means medroxyprogesterone. So again, the hormonal interferon device, liver not gestural, no
Oh,
hard
emergency
adjustment.
level.
Emergency something
Intrauterine
better.
tubal.
Interferon device.
No, there is fibroid.
Yeah, there's a fibroid, but not disturbing. But we don't know the size of the fibroid, right, doctor?
Yes. Levonorgestrel, maybe.
Levo
But
not gestural.
ST Johnson what here inducer. Levonorgestrel not safe. Levonorgestrel.
الانتي ديبريسون دي هنا كونتر انديكيتد مع
ايوه
Yeah,
دي
doctor. Let us see. Good. Levonorgestrel. So, doctor, who has given the levonorgestrel? Can you explain to us? There's a various opinions. Why you have chosen levonorgestrel? Why not Depo-Provera? Please. Sorry, doctor. You
not
have...
emergency contraceptive.
Yeah. You are right. Levonorgestrel could be. So, doctor, make it. I think you have gone through the text. If you know, you can make a snapshot, doctor, for better understanding. I will request to go through the detail after the class today. So it will be inbuilt in your brain, doctor. Now, patient number 14. Woman rings the surgery. That is over the telephone you are talking and put through to you as a duty doctor. Anyway, for that reason is put through to you as the duty doctor. Okay. She had an uncomplicated medical abortion 13 days ago and last night had unprotected intercourse. She's not sure if she needs emergency contraception. She has no contraindication to any particular form of contraception. Now choose one. 13 days before abortion happened. Please choose one.
When they not no need.
Not required.
B.
Emergency.
Not required. When they
Not
not
required.
required.
One day not required. Last night, yeah, last night. One day not required because she's post what is abortion? 13 days after abortion, right? So unlikely she become mother, you are meaning. And any method of emergency can be used. So you are giving one answer, they are giving other extreme of the answer. Anyone can be chosen. Anyone. That means she needs contraception.
Even one day?
Doctor,
need
this is,
emergency
it is a
contraception?
medical abortion, doctor. She is not giving the breastfeed to the baby. She doesn't
Day
have the baby.
13.
Right? Let us see what their
And
explanation.
in the ovulation day,
Emergency contraception, 5 days post-abortion, doctor, remember. Remember, it's a very critical information. It is not the normal delivery or the breastfeeding issue, the post-abortion. So, 5 days post-abortion. So now, after how many days, doctor? Before I'm going, abortion 13 days ago.
13 days.
13 days. So the cut-off time is the 5 days. I think very interesting, right, doctor? 5 days. Okay. Now the patient number 15. Young woman presents requesting cock pill, told by a friend to ask for cock. I'm using the short word. So which of these statements is true in regard to the choice of cock, combined oral contraception? Please, which one will be the answer, best answer? This is info type question, information type. Commonly practiced, right? Contraception. Somewhere it is said as yes.
D.
Yasmin.
Yasmin.
Yasmin is proven. So Yasmin means actually cock. Be clear. Yasmin is the cock. Combined proven to be better at reducing acne than other cock brands. Okay. No one else is correct. No one else is correct. Let us see. Dr. Dianati is working against the acne better. You can remember one, not the Yasmin. So 20 microgram ethinyl estradiol will cause more breakthrough bleeding than 30. Yes, you know, the one common side effect is the breakthrough bleeding may persist 2 to 3 months. So we assure the patient that don't worry, it will be okay. But after 3 months, it may not be okay. So we can increase the dose of this estrogen. Estrogen, a little higher dose estrogen can control it. So 20 microgram cause more breakthrough. More breakthrough. There is a chance. If higher doses use, breakthrough predict chance is less. This is the most correct answer here. Okay, doctor. I think I explained this. Huh? If you don't take snapshot, no problem. Now, patient number 16. 32-year-old lady comes to see you to inquire about the starting contraception. She says that she's been using withdrawal method of contraception, natural method, since meeting a new partner a few weeks ago, not day, and would like something a little more reliable. The more following, which of the following methods of contraception absolutely contraindicated until pregnancy or risk of pregnancy has been excluded irrespective of the timing of unprotected sexual intercourse? Please try to give the answer. To give the answer, doctor. What do you understand by the ask of the question? Irrespective of the unprotected
injection.
sex. Depo-provera injection. Depo-provera injection. Absolutely contraindicated.
Yeah.
A. Why they have chosen A?
Yeah.
Cos-hybridinol has been shown to cause feminization of male fetuses. Thing is that I am going back, doctor. Usually you understand that this is a natural method. There is every chance of conception, right? Every chance of conception. So until the pregnancy or the risk of pregnancy has been excluded, that means that you still didn't exclude. If you can exclude the pregnancy, you can choose anyone. But you are getting time or some time to exclude the pregnancy. So which we cannot advise. The meaning is that the most of the contraception is harmless if there is a pregnancy. Understand? What about the hormone and others? In general, combined pill, progesterone pill, they are not very dangerous for the fetus. If incidentally, however we say incidentally, there is the pregnancy inside. But cos-hybridinol as a contraception, as it has some effect on the fetus, feminization of male fetuses, so it is contraindicated. Okay, I think you now got to the point. They want to know until you exclude the pregnancy, which better not to be given. That is the idea of the question. I think this question may be a little difficult to understand for you. So I understood. Right, doctor. Now you understood. As explanation given to you, doctor. Thank you. Thank you. Yeah, doctor. And now, patient number 17, 18-year-old woman presents with a clipping from a magazine and asks for a prescription of Sterilization. That is a desogestrel. That is a progesterone-only contraceptive. So, with regard to this one, which one is the true information? Please choose one. If the progesterone-only contraceptive. Sorry, doctor. Can you repeat? Missed pale 12 hours. Oh, I think I discussed a little in my introductory talk today. The missed pill window I discussed. Yeah, this is the progesterone. Any difference of opinion, doctor? No one. No one. Missed pill window is 12 hours of this. True, doctor? I need to correct. 3 hours and 2 hours. The progesterone only pill. 2 hours. Another one is the 3 hours. What about we discussed about 2 hours, 3 hours, doctor? Let us see. If needed, we will correct it, doctor. Missed pill window is 12 hours. Cerazeti is similar to the combined pill marketed as having a Pearl index. It is an extraordinary pill, doctor. Might be So head-to-head trial, a very extraordinary information. Superior to traditional progesterone. So, doctor, you understood that we have the traditional progesterone only pill, but the Cerazeti is a different exceptional one. Is debated, and Cerazeti is not recommended the first line, though they are claiming is a 12-hour. But I told you before, doctor, usually progesterone only pill window period is 12-hour. Cock pill, sorry. But I told doctor, can you remind me?
Other progesterone only pills, there
3 hour, 3 hour. Progesterone only pill 3 hour in general, and the combined pill 12 hour. For that, combined pill is better. But this is exceptional question, especially for this brand. This though is a progesterone containing pill. Its window is 12 hours. So it's an exceptional. You have to remember by naming the what is that? What is the name? The generic desogestrel, doctor. Desogestrel. Remember, doctor, please write down in your notebook today also, doctor. Eh? It's a very interesting, exceptional thing. Right. So coming to the next. 18, don't worry, doctor, I will read for you, no worry. A woman who is in her 3rd trimester of pregnancy comes to discuss future contraception. So it's very alert. She in advance, she wants to know. This will be her 4th child, right? 4th child. So usually they don't want baby father. And she has come to discuss sterilization as she thinks this would be a good option for her after she has given birth. So actually you are discussing about the sterilization. She's certain she does not want any further children and her family will be completed. Which following is correct advice to give? Please take your time, few seconds more, because these are the long sentences there. And try to be speed up, doctor, because you need to develop this habit to give answer within 1 minute.
E.
That means the tubal occlusion is only true effective method of female sterilization after childbirth. After child, very easy to decide, doctor, but consider other thing also.
Our partner should be encouraged to have vasectomy.
B. أيوة.
B. Our partner should be encouraged to have a vasectomy as male sterilization preferable to female sterilization. Usually, husband don't want to have a sterilization. So no option other than this. So everybody thinking A or B, maybe someone.
Can we see?
She should be advised that some LARC, long-acting reversible method are as more effective than female sterilization. So they want to have baby. So you mean that long-acting reversible contraception will be better for this permanent sterilization or permanent blockage? Anyway, doctor, who you are giving the 3rd answer? How it is correct? Doctor, can you explain why this is correct? Why not the true? The tubal occlusion is only true effective method, doctor. Can you say why didn't you choose E? Can you explain, doctor?
Because sometimes maybe they reverse their decision, and it's a permanent method of contraception. So first of all, we should tell the patient if there is some alternative is available. Like for this one, we can give some intrauterine copper device or coil for 10 years, 7 years, like that. So that will be a good choice.
And confer non-contraceptive benefits, doctor. What benefits she wants?
First is like she don't want the baby. So that's okay. The purpose of purpose with which she came, it will be fulfilled.
Sorry, doctor, maybe interruption is there. Actually, her age is not mentioned here, right?
Non-contraceptive.
Yeah, Dr. Fawzia, maybe I'm right.
Yes,
Please, Dr. Fawzia,
oral-
please, welcome.
Sir, non-contraceptive benefits may be like oral hormonal contraceptives may give less painful periods, less bleeding in the menses, and treatment of acne. These are all non-contraceptive benefits.
Definitely benefits are there. But there may be some technical decision making. Though she is telling that her family will be completed, doctor. What is the reality in the life? maybe in the later life, she wants a baby again, right? Isn't that it? What is happening in our society also, right? She may want a baby another time. Maybe this may be a technical issue to consider here also. The woman should be aware that some long-acting reversible method, effective than female, may provide benefits such as improving menorrhagia with levonorgestrel intrauterine device use. Okay. So I think, doctor, as we are not taking more time, and you can make a snapshot, doctor. Please go through by yourself. Now the 19, I am reading for all of you. Possibly I am not keeping you forcefully, doctor, and you are here for your benefit, I believe, and I am also benefited, no doubt, for your participation in the discussion. And always who takes the class and he or she learns more, no doubt. So don't feel that you are compelled to be, and we are reading for you. And we have few more cases also. Don't worry. Maybe after a few minutes we can finish. Now, 19th patient. 27-year-old female attends the GP surgery 3 weeks prior, was commenced on carbamazepine. You know, doctor, carbamazepine, one of the anti-epileptic drug for the use and not for the epilepsy as a drug of choice for trigeminal neuralgia. She stopped this 10 days ago and she felt no improvement in her neuralgia symptoms. No improvement and stopped it, right? So it's risky to stop the medicine if it is used for the epilepsy, but it is for the trigeminal neuralgia, only the painful situation. And as she was advised to use additional barrier contraception when commenced on the drug, as she was taking the combined pill. All of you must know that there is a drug-drug interaction between anti-epileptic drug and combined pill. A very common problem, doctor, we have to consider, which she has continued taking without having her usual 7-day break. So she didn't give the break. And she now on the day 8 of her current pack. 12 hours ago, she had again unprotected sexual activities. Now she wants emergency contraception. Now doctor decide what will be the appropriate management for her. 12 hours ago. Don't be hurried, doctor. If you be otherwise, you'll be busy, otherwise no problem. But when you read this term, be attentive, Dr. Moore. Don't say something just with confusion. You may be wrong, but be wrong with confidence, okay? With the logic.
Option
A.
Not emergency needed, No emergency needed. Okay, any other option?
I think
Same option, A, doctor, everybody?
E.
E, oh, she should be offered the emergency copper IUD, 12 hours ago, right? Let us see, yes. Why, doctor, you think that she needs contraception? Can you explain?
She was on carbamazepine and this anti-epileptic and this combined oral contraception has some interaction. It will decrease the absorption and
could be some impact on the combined contraceptive pill failure, and she is now on the day 8. Okay, usual 7 days break she did not continue, but she is on the day 8 of her current packet. Okay, so 7 days finished on the 8th day, but 12 hours ago she had the sexual activity. So now the contraception needed, doctor, right? So who has chosen that not needed? I think you need to concentrate more on the decision making. It is a matter of 12 hours, right? As the failure chance is there before by the drug. Very right, doctor. Very right. Very right. So the combined pill will not be relied upon as enzyme-inducing drug used within last 28 days. Remember, last 28 days, doctor, critical information. It is how many days? I am just going back. 10 days ago. Though she stopped 10 days ago, it will work up to how many days? 28 days. How tricky, doctor? How tricky, How tricky. 28 days. So you cannot rely upon. For that, emergency contraception needed. I believe, doctor, you are definitely being benefited, doctor, right? And like, especially those who are the male colleagues, and you are not dealing such patient also, you are now getting the messages. In future, you will be better, doctor, in your decision making. Now, 20th patient, 29-year-old man with 3 children presents. Now, coming to a topic with the men. Presents requesting vasectomy, but he has recently separated from wife. True about the vasectomy. Please now decide for a male patient, male person. Partner consent means which partner? If he has a partner separated from the wife, success of the reversal procedure is
D.
greater than D.
D.
Vasectomy 10-year failure rate of about 10 pregnancies per 2000 men. So you are answering from some statistics. Appreciating you, doctor, if you will. Anyway, you may not be right also. You see, you know the statistics as well. 10-year failure rate, the vasectomy, even then, it will not protect 100%. Yes, it is true. There is a chance. Vasectomy also, the cutting the bus difference, right? So anyway, any other option? Everybody is silent. Let us see. Can be considered in men without children. Without children. It's just ethical or legal issues that without the children, he is in his right. Okay, he doesn't want to have a baby, so we can advise the vasectomy. Maybe these statistics is wrong, but there is a there's a chance of failure is there. Chance of failure is there, no doubt. Maybe not that percentage. Okay. Caution, because there is an increased risk of regretting the procedure. Vasectomy, highly okay. So we have to discuss about the pros and cons. Definitely, I have shown you in the early time, and we have to give something the psychology for the future, right? Maybe patient deciding, okay, I will not have the baby. So he's saying that, okay, I don't want baby in future. But again, do more close question 2-3 times to be more confident. And maybe there may be some legal issue also that you need to take the written consent also may be needed for the permanent sterilization. Maybe rules may be different to different countries. Anyway, so you see that vasectomy can be reversed. Okay, success rate is 50 to 80%. Success, the reverse of success rate. It is not the contraception. Yes, the success rate also can be reversed, rarely done, range from 50 to 80. Okay. Now, patient number 21. 36-year-old banker comes to see you. She was started on Depo-Provera injectable contraceptive 4 months ago. Since then, 4 months ago, doctor, started 4 months ago. She has noticed that she has an irregular bleeding, causing strain on her relationship, personal inconvenience because she does not know when she is going to bleed. Okay, irregular bleeding. She doesn't give any history of vaginal discharge and is not. She is in a stable relationship, so there is no extramarital issue. Up to date with her cervical smears, that means no cancer, and had her last one 2 years ago. Cervical cancer screening 2 years ago done, which was normal. So comorbidities are given. So what would you recommend to her now? That is for the further evaluation.
Option E.
E, trial of a short-term combined pill. To stop the bleeding, you mean, doctor? Doctor?
Because using of Depo-Provera injection it can cause some bleeding in the beginning.
Okay, so combined pill also cause the bleeding. We said it is the what I say, the withdrawal bleeding. Sorry, breakthrough bleeding. Breakthrough bleeding. Even then, you are thinking the best of 5 answer or the best answer, single best answer is this one. Or should we refer to gynecologist thinking something bad here? Yeah, doctor, we have a habit. If I don't understand, okay, refer the case. But don't do it today, doctor. Think yourself. If you can handle the case, try your best to do. Any other colleague, please come forward with another option. Let us see. So short time pill will be the solution now, since she has noticed that she has had irregular bleeding. So irregular bleeding be in the regular bleeding by the pill. This is one of the function of the pill, you know, that even not for the contraception, you know, the unmarried lady also be advised by the contraceptive pill, which is called the menstrual regulation. Okay. Now the bold word, when experience unscheduled bleeding during the use of hydroxyprogesterone, where medical eligible, can be offered a combined contraceptive pill. So this is the solution for the 3 months for the pill. Yes. I think Doctor who answered, you were very confident and you have go through the text possibly. Thanking you, Doctor. Thanking you. Okay. Okay, I think we are near to end today. 22nd patient, 38-year-old lady attends surgery to request contraception, wants to make sure she is covered from any chance of pregnancy. Make sure she is covered from any chance of pregnancy. So she has previously taken one combined pill, but stopped this a long time ago before having her 2 children. On further questioning, she tells you she had unprotected sexual intercourse 4 days before. 4 days before. So now the question is, which criteria would allow the copper device, copper implanted device, to be inserted as a method of emergency contraception? Right. Which criteria for this in favor of copper device? Please choose one.
Option C.
Option C, may be inserted at any time in the cycle within the 5 days of the first episode of unprotected sexual intercourse. Unprotected sexual intercourse. Okay, any time of the cycle. Okay, any other option? Doctor? Very good answer. It may be inserted any time in the cycle within 5 days of the first episode of unprotected sexual intercourse. So 5 days is the cutoff time. Cutoff time. So we need to know it. And previous one question also you have answered very nicely. That the immediate contraception is better done by the devices if it is not contraindicated. Okay, inserted any time and within 20 hours. That means the 5 days of the first episode of unprotected sex. This is the cutoff time. So, doctor, if possible, you write down in your notebook, doctor. If you write, the brain will write more. If you listen, there is every chance of losing for the doctor. So, and now a few more cases, doctor, regarding the missed pill, and missed pill always important. Missed pill always important. And emergency contraception already we discussed few, and maybe in future, because the missed pill is there, so it is also associated with the emergency contraception decision making. For that, again, we will discuss it with some other few issues. Okay. Yes, doctor, and this is the case now. I am reading for all of you. A woman seen 5 months postpartum. She's a breastfeeding. Now you're getting a breastfeeding lady, 5 months postpartum. So it's a long time postpartum. Postpartum, she has had unprotected intercourse and requires emergency contraception. After discussing the option, she is prescribed ulipristal acid. So, which is the correct advice to give with regards the feeding of her baby, breastfeeding issue. So, what she will do regarding the decision of the breastfeeding? Because you are prescribing ulipristal. We are prescribing ulipristal now. Okay, doctor. Try your best to choose best.
B.
B. She should be advised not to breastfeed and to express and discard milk for a week after taking ulipristal. So what you are thinking? You are thinking that ulipristal may be aspirated with the milk, right? Doctor? And this ulipristal may be hazardous for the baby. I think this is the reason to choose. Let us see. So no different option. All of you.
I think A.
Oh, sorry, doctor, you already shown the answer. You have told A. She can continue to breastfeed as normal. No, maybe about the therapeutics, you have to know about the ulipristal. Now come to that. Ulipristal acid should not be breastfed for 7 days after the use, doctor. Remember the pharmacology. Pharmacology. Okay. So in another note, doctor, you may not get the information in your bundle, I believe. Purely pistol is an orally active synthetic selective progesterone receptor modulator, acts via high affinity binding to the human progesterone receptor. When used for emergency, the mechanism of action is inhibition or delay of ovulation via suppression of the luteinizing hormone. It's the mechanism only. But the cutoff time is there. No confusion. 7 days within. Better not to give the breastfeeding. Okay. Now, this 151-year-old woman comes to see you to discuss her contraception. 51-year doctor, aged lady. She's using progesterone only pill for the past 5 years. Currently amenorrheic. So injection as well as the time of maybe of the menopause. You are right. She's not sure how long she should continue to use the contraception and ask your advice. FSH level 46 now. You have checked FSH. Actually, you are proving that she's in menopause or not, maybe, but she's on progesterone drug. What will be your now decision making? C. Repeat as FSH now, and if more than. That means the second one, doctor. Second test is more than 30. Then she can stop contraception in 1 year. In 1 year means, doctor, she is to continue the progesterone. Right, doctor? She is to continue progesterone 1 year again.
No.
Another option is she can stop immediately. So compare these two. C. So you mean that until 1 year she is to take the contraception. Though FSH is
Option
second.
B.
B. Oh, you are now changing the mind, maybe one of you. More than 30, then contraception can be stopped in the 6 months. So it's a critical decision making.
Sorry, A. If
A?
more than 30, she
Stop immediately. Oh, doctor, no problem.
Yes.
1 year, more than 30, 1 year, more than 30. Single. So you understand, single FSH, already we discussed before, should be repeated in the 6 weeks later. If both readings are more than 30, stop after a year. Remember, doctor. After a year, not the 6 months, or not immediately. After a year. Very, very, very important information, doctor. Very important information. Now come to patient number 25, 24-year-old woman taking 20 microgram ethinyl estradiol combined pill. Call surgeon to say that she missed a dose. Now coming to the missed pill. Missed a dose. She is on the day 10 of her current pack. That means considering the missed pill decision, so how many tablets she finished from the pack, it is also important. It is 24 hours. Since she should have taken her previous day's pill. That means 24 hours over. You understand the what is that? The window period is 12 hours. Window period is 12 hours. Okay, so 24 hours over now. She on the day 10 of the current pack. The 10th day, what she will do now?
Option A.
A.
Option
Miss
A.
pill with today's and carry on with the pack.
Yes, option A.
So you are thinking that it is not a critical situation, right?
D.
Or B. No more than one pill in on any particular day. B, doctor, no more than one pill. What is the hazard of taking 2 pills, doctor? I think, do you understand this meaning, doctor? The missed pill usually can be tackled by repeating the pill on the single day also. Okay. A single, it is possible. Let us see now. Missed pill with 2 days and carry on the pack. So there is no harm to take the double pill on the second day. Okay, doctor? No harm. Decision making. So with this, doctor, it is taken from the book regarding the decision making. I think you can go through well. I hope you will understand. Just make a snapshot and you can go through the book also, no problem. And doctor, come here. Patient number 26, doctor, just wait few minutes. I think within 5, 6 or little more time, minute, we can finish. A 30-year-old woman is in the third week of her cycle. That is the 18th day, 18th, and calls the surgery in the Monday morning after a weekend away with her boyfriend to say that she has missed 3 of her pill. 3 pill. That is, she is in the 3rd week now, the 18th day of the cycle. Which of the following most appropriate advice? Missed 3 pill, doctor. All of you, please try your best to give the answer. And you may face such question, doctor, in your OSCE exam in future, I know.
Option B.
Option
B.
A and B.
B.
To the end of her 3rd week, take pills to the end of her, to the end. That means you continue 3rd week and then start a new pack, missing the pill-free week. So you will not give the free week. You will continue, right, doctor? You mean?
Yes, no break.
Yes. Another option, I am thinking here that 3 of the combined will miss. That means 3 days over. But it is in the 3rd week now. Let us see.
Yes, D.
Start a new pack, but extra protection is warranted, doctor. Extra protection. Now let us see the explanation. This is all detailed, doctor. Please, you can go through by yourself. You see there is an option in the right column. If more than 2 pills are missed, I think you can go through this column, doctor, later, right? The right column. If more than 2 pills equal to or more than 2 pills, pills are more than 48 hours late at any one time, anywhere in the pack. Okay, then you have to follow this algorithm, doctor. Can go through. Those who didn't give the answer, definitely you must read it and some description by keeping the picture in front of you and go through the description. So requesting you, you can make a snapshot, doctor. Patient number 27, 29-year-old lady seen for review of the postpartum contraception. Postpartum. She's keen to be prescribed a combined pill as she has used this method in the past. That means she feels better with the combined pill. She's now 21 day postpartum. So which one following would preclude the use of combined pill at this time, at this juncture? Doctor, what is it? I think you understood the meaning of preclude. Meaning of preclude is exclude. In which condition you will not advise the combined pill? Please. Please choose one.
The baby is formula feeding.
Option
D.
C.
Option C. She suffered with preeclampsia in the antenatal period. So if you got the history, you will not advise pop pill. Okay. Any other option?
D.
D. Baby is formula feeding. So breast formula feeding, not the breastfeeding.
Oh.
So non-breastfeeding, you will not give pop pill. Okay, another option. Let us see. If preeclampsia, you will not give. What is the hazard, doctor? Doctor, who has given the answer right? Can you share? Why you didn't choose eclampsia?
Embolism.
Embolism. Eclampsia, it increases the embolism, doctor, with this pill, the postpartum period. 51 days. Let us see, doctor. So, a lot of discussion is there. The thromboembolism risk occurs during pregnancy. Higher venous thromboembolism, higher venous occur in the first 3 weeks of postpartum. And in the first, okay, after the childbirth, yes. So combined contraceptive should not be used by women with risk factors for venous thromboembolism within the 6 weeks of childbirth. That means there is the list, right? There are risk factors. So you have to go through the risk factors: immobility, transfusion in the delivery, body mass index, postpartum hemorrhage, post-cesarean delivery, and the preeclampsia or smoking. In this situation, cock pill better not to be advised. If you advise, there will be chance of this thing, bad hazard will come up. So again, maybe this colorful screen, doctor. You will not get maybe colorful screen, and you may be in the learning material. So feel free, doctor, to have it. 28. 24-year-old woman who is taking 20 microgram ethinyl estradiol combined pill calls the surgery to say that she has missed a dose. Okay, she missed a dose. She is on the day 10 of the current pack. So she missed a dose, means 1 day missing. It is 24 hours since she has her previous day's pill. That means at the end of 24 hours, she is talking to you. Most appropriate advice, because cock pill is well prescribed, well advised. So we need to know the cock pill and many clinical situations, different clinical situations we need to know. Okay, what will be your best advice? 10th day, 24 hours after, she missed 1 pill. What will tell, doctor?
D,
Can it-
she would use barrier.
Can it be the similar case before maybe we discussed? D. Barrier contraception needed, doctor. That means extra protection needed.
Yes.
She should know more than 1 pill on any particular day again. Just carry on the pack rest of the month.
Yes, option A.
And A,
Carry on with the pack, because it is 24 hours within. So doctor not needed extra pill here.
no, because it's written we can give the margin of 36 hours if still missed.
Oh yeah, doctor. The critical message is, yeah, I got the point. If anybody want to explain, doctor, you can take the chance. Okay, let me clear. Suppose she's getting the pill at the night time, and the coming day at the night time is the time to take the next pill. But he forgot in the night time, suppose at the 9 p.m. or 10 p.m. The following day, if you miss it, doctor, the missed period means within 24 hours. Okay, if 24 hours is over, that means you took the pill before 24 hours is not over, it will not be regarded as the missed dose. Patient can take within the 24 hours anytime. Understand the point, doctor? She's thinking that it is a missed dose. Missed dose means she couldn't take within this time. That means after this 24 hours, she forgot to take at the end of 24 hours. Okay. So there is some, the window period also there. Now you understand. What is the window period of this, doctor? 12 hours, right? Combined pill, window period 12 hours. So still 12 hours within. So she does not need to take the protection, and extra protection is not needed. That is the message, doctor. Let us see what their explanation. So if 2 or more pill is missed, then extra protection needed, doctor. So please, you can again see the detail. Maybe that I couldn't explain well. Time is short, doctor. You have to finish in time also. Okay. So take your time later, doctor. No, I just marked it here. 29th. 30-year-old woman in the 3rd week of cycle and call the surgery on the Monday morning. After, did we discuss it before, doctor? I'm sorry. Maybe, yeah. Even then we can read, even then we can read if we discussed before. So it will refresh us. 30-year-old woman, the 3rd week of cycle and call the surgery on the Monday morning after a weekend away with her boyfriend to say that she has missed 3 of the combined pill. What will the appropriate advice? It's the same question, doctor. Give the same answer, no problem. It will be a repetition for you. Might be something different also. Sorry, doctor. I couldn't look at detail. Give the answer, doctor.
Option A.
A. Take the pills to the end of the 3rd week
E.
and then have her pill free. Bleed as usual.
E. E,
So
last
she will
one.
not continue. She will not. A means she will not continue the pill, right? With
Yeah.
So your decision. Now maybe changing. E. Take pills to the end of the 3rd week. Start a new pack. Use barrier contraception. Possibly Yes, possibly. We repeating the situation possibly here. So again, this column, more than 2 pill, extra protection needed. Extra protection needed. The simple message. Yeah, doctor, hope to be the last case. If it is so, 15-year-old woman presents requesting postcoital contraception, right? This may be a common case. Following an episode of unprotected intercourse 4 days prior, 4 days over. What may be the true information about postcoital contraception within the 4 days? Give the answer, doctor.
Option C.
Option C. Okay, any other option? Any other option, doctor, please? No option. No different. Levonorgestrel cannot be given beyond 72 hours. Beyond 72 hours. Maybe true. Let us see. It is not true. Males cannot buy levonorgestrel from a community pharmacy. Okay, doctor, I'm sorry. It may be some rules and regulations. Male cannot buy levonorgestrel from a community pharmacy. Maybe it is varied though.
It's written like levonorgestrel should be given in the 72 hours after sexual intercourse.
Yeah. After 72 hours?
No, within.
Beyond. Oh yeah, beyond. So beyond also we can give. Maybe their time limit may be different. Okay. Time limit cannot be given. That means true information will be can be given, right? Can be given with the true information. But it is another issue, doctor. They highlighted another issue here. Males cannot buy. So it may be rules in some country, maybe in the Western culture, doctor. You know that in South Asian people can buy anything from anywhere, almost. I'm sorry, those who are from the Gulf country, you may have some restriction, but in South Asian culture, we know well. So anyway, just in additional, usually in South Asian exam, these types of questions are not available. That means some orientation in some part of the world or beyond the South Asian culture, they don't need to choose. But actually keeping in the mind, not only the South Asian countries, actually, we hope that there may be some other people also joining the classes. So 2-3 cases may be a little different. Right? There are some regional and cultural orientation to answer. Anyway, levonorgestrel can be given beyond 72 hours, but it may be less effective. This is the fact. Okay. And the pharmacist will not sell levonorgestrel to the male. A little different information for this case, doctor. So, okay. And I think we are at the end, doctor. And a few minutes, doctor, please, if I request to you, just to sum up. And we like to conclude also up to this. Maybe I tried my best for all of you, doctor, to read. But one thing, doctor, to give you the message. Discussion is important. Discussion is important, and you will discuss with each other. Whenever you have, doctor, any scenario may be critical to you, you can share with us, doctor. And I believe that some of you are in our group, but I like to invite all of you, doctor. I have given the link now. Within 1 or 2 minutes, you can join by clicking there. And we are active in nowadays interacting in the Telegram radar, doctor, for some technical reason, but one way active in the WhatsApp. One way active, doctor. So those who don't have access to the Telegram, I heard someone might be. So you can utilize the WhatsApp, and don't feel shy, doctor, to have any query to our DOAMS BD ID of WhatsApp. We will try our best. So I like to repeat, doctor, in the Telegram, you may have other colleagues to respond. If you don't have any response from there, you can just share the message to WhatsApp group. We will put there. It will be for your benefit, doctor. And again, I like to show and offer my heartfelt gratitude to all of you, those who attended our classes. I hope that this discussion will be very useful for all of you. And I committed to you that we will try our best to make it accessible to all of you colleagues. My request to share with others. And whatever I have said, mostly from this Oxford Handbook of General Practice, page number 72, sorry, 726 of the 5th edition. I think all of you have this book. It's very standard book for all of you, doctor. And be in touch and keep your eyes in our group, WhatsApp and the Telegram for future. And I'd like to thank all of you, doctor. Thank you very much. Thank you very much.